Caring for your eyesight begins with complete eye examinations. A complete eye exam is more than just testing your vision. It's a full checkup for your eyes. Many eye conditions develop very slowly and without symptoms, but if undetected, may cause irreversible damage to your vision. Regular eye exams are the best way to detect such conditions early and address them before they develop into more serious problems. During the exam, your doctor will review your health history and ask you about any eye problems. The doctor will test your vision, look at the back of your eye, and check your eye pressure. Your doctor may perform additional tests or imaging. Most adults should have a complete eye exam every 1 to 2 years. Children should receive complete eye exams regularly to detect and treat eye conditions that can affect their progress in school. Infants should have their first comprehensive eye exam at 6 months, and subsequent exams as directed by their eye doctor. If you are at higher risk due to family history, age, or other conditions like diabetes, your doctor may recommend more frequent eye exams. Remember that caring for your eyesight begins with complete eye examinations. They are the best way to detect eye conditions early and address them before they develop into more severe problems.